us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, let's talk about another new concept, big data. What is big data? So big data is extremely large data sets which are analyzed by a computer, and it reveals patterns, trends, and associations. It is characterized by the 3 V's, being volume, velocity, and variety. So volume is the amount of data that can be analyzed, velocity is the speed at which the analysis is completed, and variety are the formats of data, or basically to a degree the sources where the data comes from. Big data is collected from electronic health records, wearable devices, self-reporting and through patient portals, public health records, and government agencies like Medicare, NDIS, etc. So big data should be really effective in guiding our healthcare system, but here's an interesting statistic. Less than 1% of all the data which is, collated can actually be analyzed due to 2 issues, being number 1, interoperability, our new favorite word, and formatting problems, okay? So for example, an imaging place may put up someone's x-rays onto a system which can then be imported and associated with big data, but because it's an x-ray and not an actual quantifiable data set, nothing about that x-ray can be analyzed without a report or something going along with it. So that just gets discarded, right? So if you can imagine, if we get to a point where all our systems are interoperable and the formatting comes along with certain reports with everything, then we can get a much larger data set which makes it more accurate, and then we can use that to help build our algorithms moving forward, making sure that our use of AI systems is definitely going to be beneficial to the patients in Australia. Okay, so how is big data actually used? So we can use big data for health promotion and targeting interventions to prevent issues from getting worse. So for example, early warning signs of flu outbreaks in Australia. So if there is a pocket, whether it's a suburb or a larger area or a city, and people are all of a sudden going to the chemist because they're just getting cold and flu tablets. And have you noticed that if you need proper cold and flu tablets, they need to take your details down over the counter? Well, this is one reason why. All that data then gets sent off, and all of a sudden, if there is a large amount of people in an area going to the chemists for cold and flu tablets, well, guess what? There's probably going to be an outbreak of flu. So then they start putting early warning signs in, they start putting radio advertisements and, reminding people to cover up, social distancing, wash your hands, etc. It also can be used for clinical decision making. So hospitals use it to guide treatment in critically ill patients. Okay, so when they don't have time to sit down and work out what's going on, they rely on big data to say, okay, in the past with X amount of cases, this has been the correct treatment, let's go with that. Systems admin and delivery. So the state government uses big data to predict hospital admissions and optimize bed availability. So this goes hand in hand with this one. If they see that there's a current issue that may be increasing and they know that those patients may be needing beds for 2 or 3 days at a time, they'll try and shuffle things around to accommodate the influx of patients which could and probably will come. And finally, for policy and funding, all right, and there's many reasons for this. Obviously, if there are lots of people going to a certain area or a certain system, then the government will hopefully shift funds towards that system. But also an actual explicit example. So the Registry of Senior Australians, or ROSA, used big data to reform the availability of psychotropic drugs in the aged care facilities, because a lot of those patients who are experiencing dementia and Alzheimer's and typical pain relief wasn't alleviating their concerns. So they were just handing out psychotropic drugs, not willy-nilly, but more easily than they are now. So now you need actual ongoing care and a doctor to sign off every time. So there are some examples as to how big data is used. So how do we use this data to reduce the expenditure in the healthcare system? So big data can provide predictive analytics leads to identification of at-risk populations early, therefore avoiding expensive late-stage treatments, okay? So for example, early intervention of type 2 diabetes in certain populations will therefore hopefully allow those people to manage their condition as opposed to picking it up too late, at which point their kidneys fail and they need to have transplants, or maybe they need amputations because of the lack of oxygen going to different parts of their body. It can be used for operational efficiency to predict adequate staffing levels in certain systems and sectors in the healthcare system to ensure that there is not an overstaffing problem. But most of the time we don't have an overstaffing problem in the healthcare sector, but you can have too many staff in a certain ward in a hospital, for example. Evidence-based medicine reduces the usage of procedures which do not lead to enhanced outcomes. So big data was used. They noticed that ongoing colonoscopies to try and pick up bowel cancer wasn't actually being very successful in detecting bowel cancer rates. So a colonoscopy does pick up bowel cancer, for the record. There are other less invasive procedures, like a blood test these days, that you can get to that are more accurate in detecting bowel cancer. So therefore they're like, well, let's not put all these people through colonoscopies because basically they're in hospital all day. It's a day procedure and there's a lot of prep that goes into a colonoscopy as well, whereas all those resources can now be pulled elsewhere. And finally, big data recognizes that certain populations can't access GPs and doctor services. So that's where they target the telehealth systems, and by doing so, it actually reduces travel subsidies that people need to apply through the government for to go and see a doctor, but it also reduces hospital admissions because, once again, due to early detection, they're able to help patients sooner as opposed to waiting until a late stage when they need to get some more drastic treatment. So how is our big data being used to cure and manage disease? So genomic medicine studies DNA in people to create personalised treatments. So for example, the Australian Genomic Health Alliance uses big data to increase early cancer diagnosis and therefore customise therapies based on the genetic profile. So we know that we can't just hit everyone with the same treatment, particularly with cancer. So by using genomic medicine, they're able to go, okay, well, we can see that your DNA strands in the past with all these people, this route of treatment has worked best. Let's do that. Also for AI and drug development, like have you ever actually thought about how medicine is developed to help people with illness and disease? So the CSIRO uses big data to conclude which drugs might work for certain illnesses and diseases, right? They don't just get a whole bunch of people in and they do clinical trials, fair, but they're usually on a smaller scale. Whereas big data, before the clinical trial gets run, big data runs certain compounds against millions and millions of data sets and then goes, hey, you know what? This drug might work with this strand of illness or whatever, and then we'll run a clinical trial from that. So looking at how do we manage disease, so the National Cancer Screening Register, or the NCSR, it does track screening data to ensure that people access timely checks to ensure that they can pick up cancers earlier. For example, if you are in a certain age group or a certain sex, or you live in a certain population, if there are people in that population that probably should be screened and they haven't got screening, then the NCSR will contact them and say, hey, we really like you to come in for a breast cancer screening or a bowel cancer screening or something like that. Finally, real-time disease surveillance. So there is a system called NNDSS, which stands for the National Notifiable Disease Surveillance System, tracks data in a real-time sense on COVID-19 and flu. So once again, from hospital admissions, chemist usage, GPs, etc. So that health officials can respond rapidly to outbreaks and get that contained before it gets spread. So the last thing we need to talk about is how is privacy and confidentiality being addressed with our big data. So first of all, let's look at the organizational, or like from the systems itself. So data encryption and security, I talked about this yesterday in the video. So all the data has to be encrypted and secured somewhere, and it's stored in multiple places, so they can't just access it and they've got all the data, right? The data is also anonymized, or goes through a process called anonymization and de-identification. So when the data goes into the big data set, it doesn't go with it your name, your address, your telephone number, etc. All it is basically your gender, and then basic biological statistics, height, weight, date the data was taken, etc., and then whatever the actual condition is that's actually being uploaded. Access controls, so obviously only people with certain, levels of access can see the data. And also there is legislation, so look at the Privacy Act from 1988, that it has clear notifiable data breach plans in place. So if data does happen to be compromised, people that may be affected, even though they're anonymized, people that may be affected are let known of that data breach. And then lastly, on the little level, what can we as individuals do? Like this is all very common knowledge and hopefully everyone's doing it, but securing devices. So making sure you've got passwords on everything, but the password is like, multiple characters long and it has, symbols in capital letters and numbers in it and all that kind of stuff. So not just, I like dogs, for example. And obviously using encryption with that too. These days, there is a lot more of two-factor authentication going on. So you may have like a really, really complex long password and you enter it all into, MyGov or Medicare or whatever, and then you'll get another prompt that gets sent to either another device or an app on your phone or an email, or sometimes you're going to even get a phone call to authorize, hey, did you try and log in here and see this data? And you say yes or no or whatever. All right. I reckon one day this will become three-factor authentication because we'll probably have to enter in a password, then we'll have to OK it on a device, then we'll have to OK it on like another device or something. Anyway. And then finally, limiting sharing. So people at the end of the day do have the right to opt out of data being shared. And we're not saying that all data should be opted out, but what we're saying is that people should think wisely or think critically about who is getting that data, okay? Is it okay that Medicare knows you have the cold and flu? Yes, that's probably important. But is it okay that the local Lions Club knows you had the cold and flu? Well, it's not really relevant. It's not going to help anything in the big term. So no, I'm not going to allow them. Not that they'll be asking about your cold and flu data. That's just an example. So that was privacy confidentiality, and that will end our video on big data. Thanks.